The Catholic CARITAS Nigeria, the charity arm of the Catholic Bishops' Conference of Nigeria, CBCN, has organized a 3-day regional planning and peer review meeting on faith-based approach to increase identification and treatment of HIV children, Faith Project. The Faith Project, which is sponsored by the UNAID, is being implemented by CARITAS Nigeria in 3 states, which are Enugu, Imo, and Abia in the southeastern parts of Nigeria to prevent mother-to-child transmission of HIV and AIDS. The report.
From Democratic Republic of Congo, Côte d'Ivoire, and Nigeria, they gathered here at the Catholic Secretariat of Nigeria for the 2023 Regional Planning and Peer Review meeting for the faith-based approach to increase identification and treatment of HIV/AIDS in children.
The Faith Project is an ancillary project of our General Comprehensive HIV Treatment Program. It was originally called GRAIL Project. GRAIL Project is that project that galvanizes church leaders because of their unique positions in society. They'll be able to mobilize people to own up with a view to finding out their HIV status and then the ability to link them up to treatment. And especially for infants, children who are vulnerable, that because of the societal influence of church leaders and religious leaders, they will be able to mobilize community to accept the efforts being made to put people who are HIV positive on treatment. So all this while, for the past 4 or 5 years, we have been on this program and have recorded tremendous success in the states where we operate.
It's not over, and the current project aims really at increasing the identification and then the treatment of children living with HIV and AIDS in all those 3 countries. We have made progress in identifying and then putting people on treatment, and globally we have about 75% of adults living with HIV and AIDS who are on treatment, but only 52% globally of children living with HIV and AIDS who are on treatment. That figure is further low in Nigeria, where only 32% of children living with HIV and AIDS are on treatment, and about less than 40% of HIV-positive pregnant women, are also identified on treatment. So it is good to see faith-based organizations, so they've played a key role since the discovery of the HIV. They've been playing a key role in ensuring that they take care of sick patients, that they mobilize the community, and that they can also provide treatment and prevention, so in the community.
The strides we have achieved together in combating the spread of HIV/AIDS and providing care to those affected have been remarkable. Your tireless efforts in raising awareness, offering vital healthcare services, and advocating for prevention and treatment initiatives have played a vital role in saving lives and fostering health. As we move forward, we are excited to reaffirm our commitment to this critical cause. We pledge our continued support to CARITAS and its initiatives, vowing to stand side by side in the fight against HIV/AIDS. Together we can further amplify our efforts, reach more vulnerable population, and work towards a future free from the burden of this disease.
CARITAS Nigeria is implementing the UNAID-funded Faith Project in 3 southeastern states of Enugu, Imo, and Abia states, where they carry out advocacy to prevent the transmission of HIV/AIDS from mother to child.
The project is a PEPFAR UNAIDS initiative that funded in Nigeria as well as the Democratic Republic of Congo and Côte d'Ivoire. The 3 nation states are working under the supervision of CARITAS Internationalists to be able to, drive this project. The project is trying to use the faith-based approach to increase case identification among children. And this is because it's an innovative approach, because it is one way that is not, it's one strategy that has not been well harnessed over time. So the goal is to be able to leverage the influence and the reach, as well as the respect that religious leaders command across board, to destigmatize HIV in the first instance, and thereby increase, spontaneous desire for testing for HIV in communities, as well as in congregations. It's actually an offshoot of previous faith-based interventions like the Baby Shower Initiative, as well as the GRAY Project. And the GRAY Project was implemented also by CARITAS Nigeria from 2017 to 2022, during which period we were able to, train a number of religious leaders that help us in, that project was actually galvanizing religious actors towards accelerated identification of pediatric HIV/AIDS.
So faith projects, like the name implies, of course, is a faith-based approach, towards intensifying identification of children living with HIV and linking them to treatment. So across the 3 supported states of CARITAS Nigeria on the ASEX project, that is Imo States, Enugu States, and Abia States, we actually have rolled out the faith project, ensuring that we get to the grassroots where we identify children living with HIV who are still not initiated on treatment, and also where we also create opportunities for identifying children who are exposed to HIV from their mother, and ensuring that they get tested, okay, and also are linked to treatment. So through this approach, it's more like a collaborative and integrated approach of both identifying women who are infected with HIV and getting them tested and initiating them on treatments and following up with other PMTCT interventions such that their exposed infants don't get infected. So on the other hand, also, we also use the same platform to identify pediatrics who are also infected, so and such that we can test them and get them initiated on treatment as early as possible.
The FAITH project, which started in 2022, has yielded remarkable achievements going by the testimonies of beneficiary states. In Abuja, Tony Abba, CTV News.